My name is Dr. Jennifer Gourdin, and I'm a board-certified sports medicine physician practicing at Kaiser Permanente in Silver Spring, Maryland. Today, I'm joined by two of my amazing colleagues, Dr. Julian and Dr. Golden, and we are excited today to talk to you about some sports-related injuries that we commonly see in young athletes. With the start of school and fall sports gearing up, we often see an uptick in some common sports-related injuries. And today we hope to talk to you about those common injuries, how to prevent them, and how to treat them. Let's get things started with introducing my panelists, my colleagues. Dr. Golden?
Yes, hello, I'm Dr. Kristy Golden. I am a board-certified podiatrist, certified in foot surgery as well as reconstructive rear foot and ankle surgery, and I practice in the Largo Medical Center.
Awesome. Dr. Julian?
I'm Dr. Julian. I'm a board-certified orthopedic surgeon. I specialize in hand and upper extremity. I'm also the chief of orthopedic surgery in DC, Southern Maryland, and I practice at Largo and Kensington.
Awesome. So if you're joining us live, we're excited to hear your questions. Please feel free to type them in the chat. And while we're waiting for some questions to come in, let's go ahead and jump things off with talking about some common injuries that you're commonly seeing, Dr. Golden.
Sure. So with the start of fall sports, I'm seeing a lot of shin splints, always with ankle sprains, and Sever's condition, which is a pain in the back of the heel in adolescent children that we see an uptick in come this time of year every year.
What about you, Dr. Julian? What are you commonly seeing in your practice?
So there's a vast number of orthopedic injuries that come up, especially in the fall when kids are going back to school. They really kind of fall into three main buckets. And I would call these the acute injuries, the overuse injuries, and then the combination injuries. So acute injuries in the upper extremity, we see things like mallet fingers, jersey fingers. These are injuries to the flexor tendons and the extensor tendons. We also see a number of acute fractures, things like clavicle fractures, wrist fractures, ankle fractures. Now, on the other end of the spectrum, we have these pure overuse injuries. And so these are repetitive injuries that we'll see like Little League elbow, Little League shoulder, and gymnast wrists. These are really due to repetitive strain of the growth plates. And then finally, I call the combination injuries. These are sort of a little bit of both. It's the calf and the hamstring injuries, the flexor tendon strains. So these are usually acute injuries that present due to repetitive overuse.
Yeah, I think in my practice, in our sports medicine department in Silver Spring, I'm commonly seeing a lot of overuse type injuries, especially this time of year. I think it has a lot to do with, kids take the summer off, they're at home relaxing on the couch, and then, school starts back up, they're getting back into their sports, and they just try to go out there and go 100% right out the gate. And there's no real gradual, progression in terms of their conditioning and strength training. And so because of that, they often end up with these types of injuries. And when I see them, I really try to counsel them, not only on the importance of that gradual progression, but also just, knowing that you can't do too much too fast too soon. You really got to pace yourself.
So Dr. Gourdin, when it comes to a gradual progression, what do you recommend in terms of gradual warm up for a football athlete or soccer athlete, things like that?
Yeah, I often will counsel them and tell them, start with just basic conditioning, light jogging, a couple minutes, maybe like a 10 to 20 minute light jog, and then gradually increase their intensity. If they don't want to gradually increase their intensity, they can start with less time and gradually increase the time. And then also, they need to make sure that they're incorporating strength training and flexibility training, because that's also an important part of your training when you're starting a sport. Making sure that your joints are flexible and that you're strong will help to prevent injury. So I talk to them a lot about that. I also talk about the importance of nutrition, because young athletes will often forget that it is important that you eat balanced diet, that you're drinking plenty of water, especially with the recent hot temperatures. There's always a risk of heat related illnesses. So you want to make sure that you're properly hydrating yourself, drinking at least at a minimum 64 ounces of water a day. But if you're a young athlete and you're out there sweating hard, you probably need much more than that. And then also making sure that you're getting proper sleep. You need at least 7 to 8 hours of sleep at night, because that's the time that your body needs to restore and to recover itself.
Yeah, I completely agree. We see a lot of flexibility, patients who are not just single sport athletes, that cross train and work on their flexibility as much as they work on their strength. Those kids tend to have far less injuries. So in any athletic kid, and really anybody, I usually recommend yoga. A 10-minute yoga practice a day for a kid can make a huge difference in their flexibility and just how tight the musculature is around their heel in particular. Because, once heel pain in particular starts, it's usually from tension in the Achilles tendon and like the back of the leg going all the way up in your hamstrings as well. It's really hard to get rid of it. It can really take them out for several weeks of their season. So yeah, I really put a big emphasis on yoga and flexibility training.
Yeah, you bring up a good point, Dr. Golden. It is great for young athletes to know that they should diversify themselves in terms of sports. Like, don't just stick to one sport, because that will often lead to an increased risk of injury as well. I think the old thought was, if you want to be the next Michael Jordan or Serena Williams or Coco Gauff recently, you have to play one sport from a very young age, and you have to practice that one year round, repetitively. But that can often lead to those overuse type injuries that we've been talking about. And so doing, different sports throughout the year will help you to work out different muscle groups and work on different, joint flexibility, and you're less likely to have injuries.
And definitely to touch on something that you guys both said, professional athletes nowadays, you've got LeBron James, you've got all the basketball players, all the Kevin Durant's of the world. These guys, they all do yoga. They all really work on flexibility. They've got their personal trainers, and they realize that there's so much that goes into injury prevention before and after the match. And so really working on that and taking it to heart, I agree 100% about the yoga and the stretching. It's part of your exercise diet.
Mm-hmm. Yeah.
Certainly.
I have sporty kids myself who are in soccer, and the problem is kids arrive and then they start playing right away. They'll arrive to the game and the game starts in 5 minutes. So it really is important to show up a little earlier and take that time for yourself to get your body warmed up, because it's usually not done before the games.
Yeah, I often talk to my patients about the difference between the different types of stretching and warm-up routines. So I think before, you play a game or before practice, it's a good idea to do dynamic stretching. So that's things like, squats or forward kicks or lateral lunges, versus static stretching, where you're like bending over and touching your toes and holding that position. Because certain sports like track and field sports, if you do static stretching before you compete, that can actually have a negative impact on your performance. So dynamic stretching is definitely what I typically will recommend that young athletes do to warm up before games and practices. And then they can focus on the static stretching afterwards, because that will also help to improve their flexibility after their body has been, warmed up and they've been playing for a while.
Yeah, that's good.
Yep. The warm up part of things is really important. Muscles, soft tissues, they're very pliable, and they do need to be warmed up. You can't just go from, like you said, from 0 to 100 degrees right away. You've got to really warm those muscles up. You've got to do the dynamic stretches. You've got to do those exercises to get your body properly warmed up before any competitive event.
Mm-hmm.
Switching gears a bit, Dr. Golden, I feel like a common question I get is, what's the best running shoe or training shoe? And I feel like as a podiatrist, you might be the best person to answer that question. How do you normally counsel your patients when they ask you about proper, like the best shoe, or what kind of shoe to wear?
Sure, I love talking about shoes. I really think about 50% of, people who see podiatrists for care that didn't have an injury, probably could have been prevented, that pain, with the right shoe. And the thing is, you really have to seek out the right shoe, because the ones staring at you in the front of the store generally are not supportive enough, and can lead to all kinds of problems. So when you're looking for a shoe, basically the sole of the shoe, the part that your foot touches, it doesn't matter the part that touches the ground, right? The part that your foot touches should be raised in the arch. And so your arch is actually supported by the shoe itself. It doesn't matter if it's a flat shoe. There are plenty of sandals that have an arch built into them that appear like flat shoes, but the part that touches your foot is actually providing support. And if you can hold a shoe, I'm going to put my hands in the camera here. If you can hold a shoe and twist it and bend it like this, then that's not a good shoe, for any type of activity. So thick, supportive sole with a rise in the arch is really important. The thicker the sole, then they can build like a heel cup underneath the heel, and that lets the heel sit down in like its own little crevice, and that helps with really common conditions like plantar fasciitis and Achilles tendonitis. Yeah, very
So,
much so. But I would avoid anything flat. Those super flat sandals for kids and adults just generally leads to problems.
so Dr. Golden, some of the new rave or the Flyknit shoes from Nike, and maybe I'm not supposed to say it on the Facebook Live, from some of these other companies, some of these big companies. Do you recommend those for long-term running and for sprinting and for distance running?
So generally, I'm a maximalist shoe person. So, I would get away from that barefoot running movement. And we've seen a lot of problems from that, a lot more pain than I think than people benefited from it. People were injured by that minimalist shoe movement. So the thicker the sole, the more supportive it is. I generally tell people to look for one contiguous sole piece. So as opposed to soles that are divided multiple times along the bottom, that's really made to impart flexibility, which isn't good for running.
Well, I think another common question that I often hear in the practice is, at what point does a sports injury warrant a trip to the doctor? Dr. Julian, what do you typically tell your patients when they ask that question?
It's a good question. So anytime you're concerned here at Kaiser Permanente, we're here to help. So bring your kids to the urgent care, take them to the PCP. They'll get to podiatry, they'll get to AFM sports medicine, they'll get to orthopedics. But typically when you fail non-operative management, so there's some things you can do at home. Non-operative conservative management, really things like rest, ice, elevation, compression, the Rice method. That's what you want to start off with. If after 48 hours or even a week of failure of that, after an injury, definitely come see us.
Yeah, I would agree. I mean, I think just remembering, that Rice mnemonic, rest, ice, compression, elevation, that's a great starting point. And I think if things are not improving with that, it's always a great idea to check in with your sports med doc or your primary care doc and go from there.
Yeah, and
Definitely.
I
And
would, oh, sorry, go ahead.
I was just going to say, it can be as simple as just needing an ankle brace or a knee brace or some kind of supportive element that you need. It doesn't always have to be surgery. We don't surgery is sort of the failure of non-operative management. So we try to just, we really try to get you back onto the field as quickly and as safely as possible.
Yes,
Dr.
and
Golden? Oh, go ahead.
yeah, sorry. I would add that, those quick ankle turns that happen so often in sports, they often don't hurt right away. And so I'll hear a lot of kids kept playing through the game or continued the practice. And then at the end of the practice, their foot was so swollen they could barely take their shoe off, a lot of pain. So if there's a roll, if the ankle rolls or if there's any kind of acute pain, especially in the bottom of the foot or in the ankle, in a kid, they really should stop the activity, start the rest, ice, compression, and elevation, see how it feels the next day. Sometimes it turns out to be nothing, but if you keep playing on a sprain, even for, a couple more minutes, you could really do more damage.
I think that advice also applies to concussions. I mean, I know they're two completely different injuries, but, if your child suffers a head injury and they're complaining of any symptoms of headache or fatigue or balance problems or memory problems, or they're just not acting their normal selves, I think it's important for parents to know, your child should stop playing. They should be evaluated, before returning to the sport.
Dr.
Yes.
Gourdin, are there certain sports we're seeing a high uptick in concussions in adolescents?
I would say we commonly see them in females that play soccer would be a common sport. For males, of course, football. That's what everyone always thinks about when they think of concussions. But for females, I would say soccer is a common one that will often see concussions. And so just knowing the signs and symptoms of a concussion and knowing the initial steps to take, like I was mentioning, remove the athlete from the game, have them evaluated by a physician is really key, because that can make a huge difference in terms of recovery. The athlete who has a suspected concussion should not just be evaluated one time. They should be evaluated multiple times over, the course of several days to make sure that it's safe for them to return to the sport.
So in the NFL, they've got the baseline neurodiagnostic testing that I think all the athletes are doing it during preseason. All the rookies do, and that's their kind of baseline test. Are they starting to do that in high schools? And what are your thoughts on that?
Yeah, some high schools do it. I mean, it's not as common as on the college level and the professional level, but there are some, high schools that I have heard of doing those assessments. And I think they're definitely useful in terms of, evaluating an athlete's symptoms. It definitely doesn't make the diagnosis of a concussion, because the diagnosis of a concussion is a clinical diagnosis, meaning that that's something that a physician would make after making observations in terms of a patient's signs and symptoms that they're exhibiting. But their scoring on those assessments definitely helps guide, the management once they've been diagnosed with a concussion, and also helps to guide their return to play.
Yes, thank you for that. I'm so glad there's more attention on concussions in children now, with everything that's happening in the NFL, and people are talking about it more, coaches are more aware of it, trainers and parents. So it's so important.
Yeah. I think one other thing that I think it's important to highlight is that, with a lot of injuries, there are some injuries that are more common in certain patient populations than others. Like, for example, ACL injuries are very common in female athletes as opposed to male athletes. And that's for a variety of reasons, but I like to bring that up when I see my young female track and field or basketball or soccer athletes, because I think it's important for them to know that there are prevention strategies that they can do now before, having an injury, to hopefully prevent them from having an ACL injury. And so knowing what those, simple added, exercises are that they can add to their warm up can make a huge difference.
Yeah, I agree. I think the data sort of shows that females anywhere from 2 to 8 times the number of ACL injuries in the adolescent age group. And for females, they talk about the increased quad forces, lower knee angles, and also increased joint laxity. They contribute to putting the ACL at risk. So back to what you were saying before about cross training, stretching, some of the preventative measures, I think these are much more important for our young females to take note of, more so than the males. Because an ACL injury, you're out all season. You're done. It's 9 months.
Exactly. I think, one thing, if there are any parents out there listening, if you have a, daughter and you are watching her on the basketball court, and when she jumps up and she lands, if her knees are, turn inward, almost like a knock knee position, that's a warning sign for you that she needs some, preventative strategies, because she's high risk for having an ACL injury just by her mechanism of jumping.
Dr. Julian, do you find that orthotics, customized orthotics, help in kids with knee pain? Because, we get a fair amount of orthopedics, orthopedic doctors who send their patients to us for orthotics when their feet don't hurt, but they're more thinking of prevention of knee injuries or treating actual knee pain.
Yep. That's a good question, and we do feel that it can help because what you're looking at is a valgus angle of your knees, and if you can wear better inserts that can offset some of the valgus load and kind of restore your normal knee kinematics and overall alignment.
Mm.
Yeah, that goes along with the athletes that have the patellofemoral syndrome. That's a very common condition that I see in my practice where young athletes coming in with anterior knee pain. And it has a lot to do with their knee being in valgus or, the way that their kneecap is tracking up and down when they're jumping or squatting. And so focusing on, giving them some arch support, but also strengthening their quads and their hamstrings and their glute muscles is really important for them to do in order to recover from those types of injuries or conditions.
Definitely. One thing I always tell my young athletes, an ounce of prevention is worth a pound of cure. So for us, in athletics, our prevention, it's the stretching before, it's the stretching after, it's the cross training, things like that can really contribute to keeping you on the field. And that's ultimately our goal.
Yes.
Not to go back, but I think I just thought of something that I commonly will get asked that Dr. Julian, you might be great at answering is, young athletes often want to know, if I tear my ACL or, I dislocate my shoulder, how long am I expected to be out? Like, what's my return time if I need surgery versus if I don't do surgery? I guess we could stick with ACL. What is your thoughts on that?
Yeah, good question. So I try to take an individual approach to all of these. General guidelines for an ACL, you're looking at about 9 months. And this data is really supported in NFL as well. Quarterbacks, running backs. It's a good 9 months until you start being able to do the cutting, the jumping, and the things you did before. Now, there's also a psychological component of returning to sports because you'll see plenty of quarterbacks in the NFL. They'll come back from an ACL, but they won't quite look like themselves because psychologically they're not ready to be in the pocket with all the dirt around their feet, with all the hits that they're going to take. So there is a psychological barrier that goes well beyond 9 months for any individual to come back from an injury. But in general, if you're going to use a benchmark, it's about 9 months for an ACL.
Yeah, I think you brought up another great point with the psychological effects of injury on young athletes. I think it's important for young athletes to find ways to still remain engaged with, their teammates and their sport when they can't be physically out there on the field. Maybe they can, go to practices or, watch film and, be a part of it in some way, because I think when they're completely removed from their sport, that has a huge impact on their mental psyche, and it can linger over time. And so just being aware that can happen when the athlete is injured and finding ways to help them cope with that, I think is important as well.
Definitely.
So, Dr. Julian, have you seen any recent interesting cases or things that you think our audience might be interested in?
Sure. Yep, sure. We can pop over to the clavicle case. So this was a 17-year-old right-hand dominant male. He's a football player, and typical football injury. He was tackled and ended up sustaining a left clavicle fracture. So he was seen at one of our urgent cares, and he came to orthopedics the following day, and we had him set up for surgery about 4 days later. So from presentation, until surgery was under 7 days. So this really highlights a lot of the integrated care that we have here at Permanente. And so he went on to have an open reduction, internal fixation of his left collarbone. So if we go to the next slide, what we'll see here is this clavicle is fixed with a plate and a number of screws, sort of bridging the fracture. After about 6 weeks, the fracture is technically healed, but a patient will typically go back to sports at about the 8 to 9 week mark. And so he's made a full recovery. He's doing fine, and he's back to sports. So this is an interesting case that we were able to really help a guy get back to this high level of sports.
Yeah, great case. I mean, I definitely think, I see a lot of clavicle AC separations with, wrestlers and clavicle fractures with football athletes. And so, the management and outcome can vary because not all of them require surgery. But it's definitely something that a young athlete would want to see a physician about to make sure that they're following the appropriate treatment plan.
Yeah, and so in his case, he had a lot of gapping between the bones, so it was over 2 centimeters. So once it gets up that high, our threshold to go ahead and perform surgery is a lot lower because there's a high risk of non-union, meaning the bones aren't healing, and if they do heal, they'll heal in a shortened fashion. And then that also alters shoulder mechanics because if your clavicle, which is your collarbone, is supposed to be this long, and then it shortens to about here, that's going to alter a lot of things that go on in your shoulder. So those were some of the reasons why we went ahead with surgery with him.
Yeah, I think this is a great example of, cases that we can treat at Kaiser. And it also, highlights one thing I love about working for Kaiser is, our access to all of the specialists, Dr. Julian, Dr. Golden, we are close colleagues. I can easily refer my patients to you and coordinate their care within our system. And so I really think that is an added benefit for our patients to have that easy care coordination, efficient care, especially when you're a young athlete. When you get hurt, you want to be able to be seen, as soon as possible, get the diagnosis and see a specialist if you need to in order to, recover from your injury and hopefully return to your sport as soon as possible. Well, I don't know if you all have any other closing thoughts or things that you would want to share with our audience today.
Yeah, sure. I'd like to talk a little bit about body weight and vitamin D deficiency. So this is something we see a lot in podiatry. We always did, but after the pandemic, it definitely increased at least twofold. And so, in not every sport do you wear shoes. And so dancers, gymnasts, these people are pounding on bare feet just over and over and over again from heights and repetitively for years. And so for those folks particularly, it's important to have a healthy body weight going into those types of sports, especially if you're just starting from not having done it before, or you're taking a break and you're going back to it, or if you're ramping it up, you're going to gymnastics 1 day a week and you're 8 years old and now you're going to go 3 days a week. That's when we're really going to see these problems. And so healthy body weight's always important, just really helpful with preventing orthopedic pain and, pain coming from no injury, just from doing your sport. And we're seeing that paired with vitamin D deficiency causing a lot of pain. So, vitamin D is not something we get from food, really. The main source of our vitamin D is the sunlight. And so once vitamin D dips down below 30, normal laboratory values of vitamin D are between 30 and 100. So it's a wide range that's considered normal. But once it dips down below 30, that's deficiency, and that leads to weakening of the bone. So a bone that has the normal amount of vitamin D is rigid, like a stick that you can't bend. You can put that pressure on it, but it doesn't bend. And that's what you want your bones to do when you hit the ground. You want the bone to not bend. when there's some deficiency in that vitamin D, depending on how low the level is, that bone, when it's put under pressure, will bend and ultimately could fracture, splinter at the top part of the bone where it's getting the most tension, or ultimately break. And that's what a stress fracture is. And stress fractures are usually preventable with vitamin D supplementation, healthy body weight, and supportive shoes. But once you do get that non-traumatic bone pain, you almost always see vitamin D deficiency in those people, and it takes a while for the bone pain to improve. So it's good to get ahead of that, get some sunlight every day, even in the winter, take vitamin D supplements every day in addition to your 1-a-day vitamin. And if you're really concerned, lab work by your primary care doctor or pediatrician can tell you what your vitamin D levels are.
Yeah, I think that's great. All great information. Typically, when I find athletes that are deficient in vitamin D, I'll recommend vitamin D supplementation at a prescription dose initially. But after that, typically there's someone that's going to need, like a daily vitamin D dose, whether it's through a multivitamin or just strictly vitamin D. And I typically try to aim for their vitamin D level to be somewhere around 50, where you mentioned 30, below 30 is considered deficient. So I think 50 is a great number to aim for if you're a young athlete participating in sports.
Right. And we all slip down in the winter. And we definitely slipped down in the pandemic. It takes a very long time to recover from that lack of sunlight.
Yeah, I think after the pandemic, I feel like all of my patients are vitamin D
Yeah,
deficient
same.
because everyone was just indoors, not getting any sunlight. What about you, Dr. Julian? Any closing thoughts? Oh, you're on mute.
Sorry about that. Physical activity, it's important for any healthy lifestyle, and you've got to develop communication skills, teamwork, and responsibility. And in order to stay on the field longer, just remember, like I said before, an ounce of prevention is worth a pound of cure. And in athletics, our preventative measures are stretching before, after the game, moderation, diet, cross-training.
Awesome. Well, thank you to our audience for tuning into our Facebook Live event today. If you would like to learn more about some of the topics that we've discussed, please visit kp.org/doctor. And until next time.
Bye. Thanks for joining.
Thank you.